The Premier is describing this as a modest easing of restrictions, a tweaking. It depends on where exactly you live in New South Wales as to how many people you can have in your home. What's your initial reaction? Is it a smart move to ease restrictions at this point, or because we know the virus doesn't respect calendars, should we be seeing things ideally staying in place in your view?
Look, I think it's a reasonable call today because the numbers have been going down since Sunday, 30 to 15 and then 8 and 8. The biggest risk danger period is going to be in January, I'd say towards the end of the first week of January. So if we've got the wastewater surveillance going, comprehensively across Greater Sydney so we can pick up any early signals, if we keep up the access to testing over this holiday period so that anyone who needs a test can get tested, and therefore, make sure we've got good surveillance. Hopefully we'll avert anything worse.
Did it make sense to you to split the northern beaches effectively into those two zones? Are you confident that the people sitting on the northern end of the northern beaches who now are under the harshest restrictions can feel that they are necessary steps?
Hopefully they can see that it's necessary, and it's it's a really hard call to make because there have been other little clusters around other parts of Sydney as well. But I think the New South Wales government is confident that they are not spreading undetected. So they've taken a risk-based approach, which is really to put the most strict restrictions on the centre of the outbreak. And I think also at front of mind, obviously, is to, after a very, very difficult year, to allow people to have a Christmas celebration.
What would have been the thought process that the government would have gone through to get to the decision to allow 10 people to visit in Greater Sydney, but an unrestricted number of children under the age of 12? Did that make sense to you from what we know about how this virus spreads?
So there's some data to suggest that children don't transmit the infection as much. They probably get infected just as much, but they probably clear the infection quicker and are not as infectious as adults. That's certainly the ones under 12 or under 10, really, if you go by the research data. So I think that's another compromise to allow people to have their family gatherings.
Obviously, a real priority has been to try and track down unlinked cases and the source of these so-called unlinked or mystery cases, as they are called. How big a priority is that? How important is it to get to the bottom of that? And do you have confidence that we will eventually find the answers?
It is important to try and understand where an outbreak's come from, because there may be other clusters linked to that same, patient zero that we are not aware of yet. And it's interesting that the nurse who transported the person from hotel quarantine who got infected appears to have a similar strain to what's on the northern beaches. So it is important to try and unpick that a bit and understand where it's come from. But sometimes we never do find out.
Wastewater testing is extremely important as well. Today we learnt that people in the Gosford area should be on high alert, those on the central coast of New South Wales, after wastewater testing did pick up the virus there. How accurate is that? How much of a delay is there in terms of the wastewater showing us where the virus is travelling?
Well, I think the wastewater is actually the best early surveillance, early warning system. Think of it as an early warning system that tells you there's SARS-CoV-2 in your community before you start identifying people with symptoms. Yesterday we heard that it was positive, the wastewater was positive in the Hornsby area as well. So this, northern Sydney and the Central Coast now are areas to watch.
And when it comes to the testing, there's been an extraordinary turnout, some 42,000 tests completed yesterday. For those who have gone out and made the effort to get tested, can they now breathe easy, or are there some concerns of a lag on the testing time in terms of positive results showing up? Could it be too early for some of those people to actually return any positive tests?
yeah, the timing of having the test certainly makes a difference. So if you've been exposed and infected and you're incubating the virus, it won't become positive till about day 5, maybe day 4, day 5, day 6, sometimes a bit longer.
You mentioned that you're really concerned about the first week of January. I know that you've been warning that New Year's Eve is potentially a super spreading event. Would you be advising the New South Wales government to really crack down on New Year's Eve celebrations, perhaps even go further than the restrictions we're seeing for Christmas?
Yeah, I think that the biggest risk period for Sydney is going to be the January, for the reasons that I've previously outlined. And it's because we've got 2 fixed dates that we can predict. Normally when there's an outbreak happening, if we think back to Crossroads Hotel, for example, we can't predict when the super spreading events will happen. But now in this case, we do know. We know that on Christmas Day, people will gather together from different parts of Sydney in an unprecedented way. And if there's still community transmission, some people may become infected on Christmas Day, and those people will probably be at their peak infectiousness on New Year's Eve. And that's because although the incubation period is 14 days, about 90% of people become infectious within 5 to 6 days. And New Year's Eve is exactly 6 days after Christmas. That's what makes it so high risk. In addition, there's kind of very big gatherings at New Year's Eve, and also people shout, Happy New Year at midnight. If aerosols come out just from breathing, also from speaking, but when you shout, the amount of aerosol generation is much more, and that's been shown in lots of research. So I think just that the parties, the gatherings, the singing is also a high-risk activity, and the shouting Happy New Year are all risky activities.
So we all need to tone it down. Professor Raina MacIntyre, I appreciate you joining us and sharing your expertise with us today. Thanks so much.
It's a pleasure.